Across rural America, hospitals face challenges that urban communities rarely consider. Here, access to care isn't about convenience, it's about survival. Yet these facilities remain lifelines, staffed by versatile clinicians, delivering care that is often more personal and resourceful than people expect.
Rural healthcare providers adapt to specialties and the needs that they have for their organization a couple different ways. Our job is to create strategic partnerships with nearby organizations to make sure that those specialties, as well as the needs of our community, are met. And so that means that we will not have the opportunity to possibly hire them internally, but maybe we'll create a strategic partnership to bring those specialty providers to serve our communities specifically.
Having access to healthcare in rural communities is beneficial because geography shouldn't determine a patient's access to healthcare. A lot of times people think of rural care as less than the quality of care in other areas, but really what we don't understand is rural healthcare can actually be faster and more personal. In an urban center, you may have 3 hospitals that serve 100,000 people, whereas in a rural community, we have a community-based program that serves the people of this town and the surrounding regions. So actually, rather than being less than, it can be better.
At 10,200 feet, Leadville, Colorado is home to the highest altitude hospital in North America. Since 1879, St. Vincent General Hospital has been a cornerstone of Lake County, today serving as the community's only critical access hospital, rural health clinic, ER, and ambulance service. From financial recovery to new specialists and expanded services, St. Vincent is committed to keeping care close to home.
People heal better when they're at home. They're closer to family, and when they can have loved one visit, it feels less isolating than being in a strange hospital. Rural family practice really allows us to practice medicine as it was intended to be practiced. In modern medicine, we're overwhelmed with ER visits and urgent care visits where there's not a lot of continuity of care. Whereas in a rural setting where you have the small group of family practice specialists that really know you, know your family, and know your history and goals. And because we know people and we know their families so well, we can notice things early that may be missed if you're just getting intermittent care through the ER or through urgent care settings.
At Colorado Mountain College, I'm the Vice President Campus Dean for the Leadville and Slidey campuses. We have a really strong, robust EMT and fire science program here out of our Leadville campus, and St. Vincent's is a phenomenal host for clinicals. Most of our EMT students do part of their clinical rotations here at St. Vincent's, and they get great experiences. Many of them ended up hired here, hired in the local ambulance, and so we continue to see them in the community taking care of folks. Last year, around Labor Day, I managed to flip my four-wheeler right up there on that mountain pass and tumble down the hillside with my four-wheeler and break my pelvis and back in 2 places. But I got to St. Vincent's and they took incredible care of me. Immediately once I got here, I saw friendly faces. I saw former students who'd been students at the college who helped me. When I'd broken my pelvis, I don't know what that would have looked like had we not had a hospital in town. It's hard to imagine what it would be like to live in a community without primary care and without an emergency room. So being rural, doing all the mountain sports that we all do, it's absolutely essential to have a hospital where we can get taken care of when we're injured.
My wife and I were at home, and I just felt weird. It was not a good feeling. Hop in the car, we're going to St. Vincent's. An emergency doctor came. They said, "I think you're having a stroke." I had a serious situation, and they defined what it was almost immediately, and they gave me shot Blockbuster. If St. Vincent wasn't here for that specific incident, I think I would have been disabled.
Public policy has huge impacts on rural hospitals because most of the time the policy is written from a larger health institution perspective. There's 2 types of payment models in healthcare. There's the critical access hospital payment model, as well as what's called the PPS, or pay for performance type hospital model. And as a result, each of those facilities functions different financially. And if policy advisors are making policies based off of larger health institutions, specifically those under what's called a PPS payment system, they're forgetting the detriment that it might have on a critical access hospital. St. Vincent has adapted and changed its core services to align with the community to make sure it stays financially sustainable. In order to do this, going through our financial hardship, the organization pivoted to make sure that we were meeting the core services that the community needed. What I hope comes from the St. Vincent story is that rural healthcare has a place and a purpose. Access to patient care is not going away, and rural healthcare is actually the grassroots effort of providing really great patient care to the local community that meets their true needs.
St. Vincent Health is more than a hospital. It's a cornerstone of Lake County. From emergency care to rehabilitation, its mission is to keep care close to home. But sustaining rural healthcare takes more than dedication. It depends on public support, policy advocacy, and the recognition that rural communities deserve equal access to care. To learn more, visit www.stvincent.health.